friends, I'm Annie, your friendly health coach. Welcome back to my platform. Join me and let's take a look at some home remedies on how to stop heart palpitations. You can follow my health and well-being on all social media platforms. Have you ever experienced an unusual heartbeat where your heart pounds or flutters much faster than normal and you thought it was a heart attack? This is actually palpitations and not a heart attack. Palpitations are the feeling that your heart is beating hard, fast or irregularly. You may feel palpitations in your chest, your throat or your neck. Palpitation can occur at any time, even when you are resting or doing normal activities. Although palpitations can be frightening, they are not usually serious or harmful. However, they can sometimes be related to an abnormal heart rhythm that requires medical attention. Heart palpitations are usually caused by stress, anxiety, or because you have had too much caffeine, nicotine, or alcohol. They can also occur if you are pregnant. The only time you need to worry about palpitation is in real cases. Palpitation can be a sign of a more serious heart condition. If you have palpitations, you should see a doctor immediately if you experience shortness of breath, dizziness, chest pain, fainting, back, neck, jaw, or stomach pain, sweating, or nausea. Let us look at what actually causes heart palpitations. Often the cause of heart palpitations can be found. Common causes include too much or too little thyroid hormone, strong emotions like anxiety, fear, or stress. They often happen during panic attacks, vigorous physical activity, caffeine, nicotine, alcohol, or illegal drugs such as cocaine and amphetamines. Medical conditions including thyroid disease, a low blood sugar level, anemia, low blood pressure, fever, and dehydration. Hormonal changes during menstruation, pregnancy, or just before menopause. Sometimes palpitations during pregnancy are signs of anemia, depression, medications including diet pills, decongestants, asthma inhalers, and some drugs used to prevent arrhythmias, a serious heart rhythm problem. Some herbal and nutritional supplements, abnormal electrolyte levels, heart palpitations after eating. Some people have palpitations after heavy meals rich in carbohydrates, sugar, or fat. Sometimes eating foods with a lot of monosodium glutamate, nitrate, or sodium can bring them on too. If you have heart palpitations after eating certain foods, it could be due to the food sensitivity. Keeping a food diary can help you figure out which foods to avoid. Let us also look at the risk factors for heart palpitations. This includes stress, anxiety disorder or panic attack, pregnancy, certain medicines that contain stimulants such as some cold or asthma medications, an overactive thyroid gland, other heart problems such as irregular heartbeat, structural heart changes, previous heart attack or previous heart surgery. Here are a few remedies for palpitations and to slow down your heartbeat. Number 1, drink enough water. Dehydration can cause heart palpitations. That's because your blood contains water. So when you become dehydrated, your blood can become thicker. The thicker your blood, the harder your heart has to work to move it through your veins. This can also increase your pulse rate and potentially lead to palpitations. If you feel your pulse climb, reach for a glass of water. If you notice your urine is dark yellow, drink more fluids to prevent palpitations. Number 2, restore electrolyte balance. Electrolytes help move electrical signals throughout your body. Electrical signals are important for the proper functioning of your heart, and not having enough of them can cause problems. Some electrolytes that can benefit your heart health include magnesium, potassium, calcium, sodium. Most of these electrolytes are best obtained from foods. For example, you can eat more dark leafy greens and dairy products to increase calcium intake. Dark leafy greens, nuts, and fish are also great sources of magnesium. Supplements may also help maintain your electrolyte balance, but talk with a doctor before taking new supplements. Number 3, avoid stimulants. There are many substances that may make you more likely to have a fast heartbeat. Eliminating these things from your daily routine may lessen or even stop your symptoms. Stimulants like caffeinated beverages and foods, tobacco products or cannabis, heavy or excessive alcoholic beverages, certain cold and cough medications, appetite suppressants, drugs used to treat mental health conditions, high blood pressure medications, illegal drugs like cocaine, methamphetamine or other amphetamines, your own triggers will likely be unique to you. Try keeping a list of the things you consume that may cause your heart palpitations. If possible, avoid any items you think may be causing your symptoms and see if symptoms stop. Before stopping any prescription medications, talk with your doctor if you think prescription medications may be causing your symptoms. Number 4, eat a balanced diet. Eating healthy is important for overall heart health, and there is evidence that an unbalanced diet may be associated with an irregular heartbeat. A nutritious balanced diet consists of fresh fruit, vegetables, whole grains, lean proteins, healthy fat from nuts or fish. It's important to limit certain food components in order to lower your chance of developing heart problems. These include saturated fat, trans fat, salt, sugar, processed or packaged foods. Number 5, exercise regularly. Regular exercise is important for physical, mental, and emotional well-being, and it may help reduce issues with the rhythm of your heart. The American Heart Association recommends 150 minutes of moderate intensity aerobic activity per week or 75 minutes of vigorous aerobic activity weekly. Cardio doesn't have to be complicated. In fact, brisk walks have a host of health benefits, including weight loss, lower blood pressure, and improved cardiovascular health. Number 6, try relaxation techniques. Stress is a risk factor for heart problems, and it may trigger or worsen heart palpitations. That's because stress and excitement can spike adrenaline. Managing your stress through relaxation can help. Good options include meditation and mindfulness, yoga, biofeedback, deep breathing, therapy, and exercise. Try sitting cross-legged and taking a slow breath through your nostrils and then through your mouth. Repeat until you feel calm. Number 7, and my final one, do vagal maneuvers. A vagal maneuver is an action you take when you need to stop an abnormally fast heart rate. The vagus nerve has many functions, including connecting your brain to your heart. A vagal maneuvers stimulate the vagus nerve and may help regulate fast heartbeat. You can stimulate the vagus nerve at home, but you should get a doctor's approval first. Here are a few ways you can stimulate the nerve. Take a cold shower. Chant the word om or cough or gag. Hold your breath or bear down like you are having a bowel movement. You can also try the Valsalva maneuver, as there is some evidence it may help with heart arrhythmia. These breathing techniques stimulate the vagal nerve, and if your heart is beating too quickly, it can help restore a normal heart rate. It is no secret that the choices we make can have an impact on our health, so please take good care of yourself. I hope you will put into practice all the homemade remedies I've given you to stop heart palpitations and slow down your heartbeat. If you have any health concerns, please consult your doctor. If you have any questions or comments, please feel free to leave them below. Thank you and hey, bye.